NGLY1 deficiency is a rare genetic disorder affecting multiple parts of the body due to a deficiency of the enzyme N-glycanase. Enzymes are proteins which help speed up chemical reactions in the body, and N-glycanase speeds up the removal of sugar chains from proteins. Without this process, proteins do not function normally and misshaped ones may accumulate. NGLY1 deficiency is a chronic condition that presents during infancy and early childhood. NGLY1 deficiency has a number of characteristic symptoms, although the specific symptoms a patient experiences are often unique to the individual. Most infants and children with NGLY1 deficiency do not grow or develop as expected. Symptoms may include low birth weight, a smaller than expected head circumference, and missing developmental milestones, such as walking or talking. Intellectual disability is also common. Many affected individuals have motor problems including shaking and uncontrollable movements, which can range from slight tremors while trying to do fine motor skills like writing to an uncontrolled, sometimes painful jerky movement. Skeletal abnormalities may also occur, such as small hands or feet, frequently broken bones, uneven shoulders or hips, difficulty standing up straight, and dislocated joints. Some patients develop seizures, which can start as early as 2 months of age. Individuals with NGLY1 deficiency often will not produce tears when crying. This, in turn, may cause other complications, such as scarring and ulcers in the eyes, painful or irritated eyes, and poor vision. Lastly, liver problems may arise in children with NGLY1 deficiency. NGLY1 deficiency is caused by changes or mutations in the NGLY1 gene and follows an autosomal recessive inheritance pattern. This means that both copies of the NGLY1 gene must be mutated for an individual to have the disorder. The mutated NGLY1 gene causes the N-glycanase enzyme to be dysfunctional or be completely absent. N-glycanase's role is to speed up the process of removing sugar molecules from proteins. Removing sugar molecules from damaged proteins allows them to be recycled. Additionally, some proteins need sugar molecules to be removed to function. Thus, some types of proteins may begin to build up and others may be in short supply. How these protein changes cause the symptoms seen in NGLY1 deficiency is unknown, however, it's currently an active area of research. Diagnosis often begins with a clinical evaluation of symptoms and a patient history. If NGLY1 deficiency is suspected, follow-up testing is required. Usually, a diagnosis is made based on genetic testing that identifies mutations in the NGLY1 gene in a blood sample. In some patients, specialized testing may be needed that requires a skin sample or biopsy. Other blood and urine tests may also be suggestive of NGLY1 deficiency. A blood test in a young child with NGLY1 deficiency may reveal high levels of aspartate transaminase, alanine transaminase, or alpha-fetoprotein if the liver is damaged. Urine testing of children may show the presence of an unusual sugar chain, and a blood spot test from a finger prick may reveal an unusual sugar attached to a protein. Treatment for NGLY1 deficiency focuses on treating a patient's symptoms. Individuals with difficulty feeding can be treated with a feeding tube that runs down the nose or is placed directly into the stomach. Children with difficulty walking may use orthotic devices like braces or a wheelchair. Seizures may be treated with anti-seizure medications. Dry eyes may be treated with lubricating eye drops. Occupational therapy, physical therapy, and speech therapy may all help children with NGLY1 deficiency to perform daily activities such as eating and dressing themselves. Alright, as a quick recap, NGLY1 deficiency is a rare genetic disorder affecting many parts of the body due to a deficiency in the N-glycanase enzyme. Children with NGLY1 deficiency often experience a set of symptoms including a lack of tears, delays in developmental milestones, intellectual disability, and uncontrolled movements. NGLY1 deficiency is caused by mutations in the NGLY1 gene that decrease N-glycanase production. Diagnosis is made after a clinical evaluation of symptoms and genetic testing. Treatment is individualized for each patient based on symptoms.